fight's not over. It's a tough fight, but we gotta keep fighting, and it has to be not just my battle. My battle is pre-diabetes, and you look at that and say, "Oh, well, Sharon, you can do some exercise and eat right, and you'll be fine." But it's not even about me anymore. It's about the next guy.
Doing with our project is good because people should be informed about budget cuts and what these budget cuts are doing to organizations that helping the people in need, like the homeless and the poor. And these budget cuts are important.
Like budget cuts to social services is wrong because some people depend on being able to go into the social services program and things like that. And if it gets cut, then what are they going to do? Where are they going to sleep at? Where are they going to be able to get food and clothing and stuff?
Families that are receiving benefits from the different organizations, I think it is important that cuts aren't made to the organizations that provide for them because they're getting these benefits for a reason. They don't make enough to provide for their own families, and I think budget cuts are just, they're a way to get people out on the streets, and people are going to be homeless. People aren't going to be getting the medical attention they need, and I just feel like a lot of people will be affected by it. Can you tell us how your organization has been affected by budget cuts to the social services?
Probably in many, many ways. Here in the city, we do a lot of emergency housing. We have 2 shelters for families. I would say over the past 9 years, our programs have been level funded. So while everything starts to cost more and more, we get the same amount of money. So I think even from the time I started there, they probably each have about 15 less staff to be able to support families and provide a larger array of services than we used to in the beginning. So that's pretty dramatic. I know that there's not as much funding for our food pantries. It's hard to get money to support people in the community. Trying to think in some other ways that it's just that we are expected to do more with less, and that over time we've certainly seen the needs grow in the city.
Have you ever had to turn away a family?
Families do get turned away.
How does that make you feel?
Terrible, terrible. And I think that's one of the hardest parts of our work, particularly when we work with families experiencing homelessness, that the demand really does exceed the supply of housing that we have in the city. So while some of that will change, and I am proud of the homeless system here in Philadelphia. They do the best that they really can with the resources that they have. I think at one point they were ranked like 3rd in the country, which is pretty impressive with the demands that we have. But I think there just aren't enough dollars.
How many people were you able to provide services for after the cuts were cut down?
Our flow is steady. So, I mean, our shelters stay full. There's never really a vacancy. As soon as a family moves out, another one comes in. So they've stayed full. I know our food pantries have actually run out of food. I know that we've had to cut some feeding programs where there would be meals, particularly in one of our core down on Allegheny Avenue. Just can't provide these evening meals that was serving families. There just isn't money to do that.
Besides government funding, do you receive any other assistance?
We do. We apply to foundations that will grant a certain program. We have some people that are very generous in the city who give us, are just wealthy donors who can support a cause. We're partnered with Enon, Tabernacle Baptist Church, with our anti-trafficking programming. So they have provided us with a wonderful amount of support to be able to do the services that we do. So I think it's really only through partnering with other organizations and individuals that we can provide the level of service that we want to.
So have you ever partnered with Project Home?
Yes, yeah.
And do you know how many families were able to get houses because of that partnership?
We just had a group move out of one of our other housing programs into Project Home. We've had quite a few move into their permanent housing. Yeah, yeah. They're a good program, and I love that they really are housing focused, and that we can all have our focuses. And we do a lot in our emergency housing programs, helping families to kind of address the trauma that they've had, to help them prepare a little bit more for being independent and taking care of themselves and their families. And Project Home does the housing really, really well.
Okay, so budget cut. He's trying to cut out all of these programs that give us housing. And
I know.
Just how do you feel about that?
Devastated. I mean, when I read some of these things and I read about the cuts, because we get funding from the federal government, right? Money that comes to the state for our emergency housing programs. We have HUD programming, so we also house seniors. There's senior towers behind us, and there are another 2 out in West Philly that are HUD funded. So we're not even sure what that will look like for housing low-income seniors here in the city, whether they'll be required to pay more. So we're sort of bracing ourselves into trying to figure out what this really will look like and how we can develop some other partners that can help us continue to do our work. But it is frightening. And when you look at, if you look at the big pie chart of the federal government, there's only this much is social services, right? It's so tiny, and then when we talk so much about it, it makes it seem like we're spending all of this money, and in comparison, it's not that much, especially with the impact that money can have on lives.
Okay, so our theme at our main building is not all heroes wear capes. And technically and apparently you are a hero. The type of work that you do, why do you believe that it is important?
I just think we have to care about others.
To the light that shines within all of us, staying captive to a false solution such as budget cuts and a reliance to a broken down government will release the pain that stirs in the ghettos of Philadelphia. But they call this pain revolution, while freedom is what we call for.
I feel that there are so many people willing to help the homeless, but they're not getting recognized for it.
I feel that budget cuts to social services are hurting so many people, and no one seems to want to do anything about it. People are living on the streets in their cars or on family members' couches, and I don't think that's fair. They're being pushed away and have nowhere to go.
I feel like budget cuts are a big issue because there are a lot of people who will be pushed out of their homes because they don't have enough money. And the homeless shelters also don't get enough money. So there will be a lot of unsheltered homeless people out there in the streets. And I feel like we need to do something about it.
Let's see. Project Home has changed my life tremendously. My name is Sharon. I'm 53. Unlike most people, they think when you come to Project Home, you're either an alcoholic or on drugs or have mental illness. That's none of my issues. I came to Project Home from domestic violence. And if you know, in communities where you have domestic violence, women usually leave their homes and leave their families, and the husband stays in the home, but the mother leaves with the kids. So from that, I had to go to shelter, Women Against Abuse shelter, and it was Project Home that opened up its doors to give me where I could go to a safe place, getting an affordable apartment, just literally starting all over again from ground zero. So when you say how has it changed my life? Tremendously.
Oh my gosh. Project Home, I've been involved with it for about 6 years. And there's no part of your life that is not impacted by Project Home. And it's more than just putting a roof over your head and giving you a warm, safe place to sleep. It's about the family and the intricacies that happen every day in any family. So it's tremendously changed my life for the better.
I think it's important because it helps you understand your voice. It helps you to understand how you can impact not just your life, but the lives of others.
Budgets, there are actually many budgets happening all at the same time. There are two that I'm going to talk about. The first one is Harrisburg. That's our state budget. So Harrisburg has not, Harrisburg passed a budget. They said, here's our budget for the next year. What they didn't pass was a way to pay for it.
What?
They said, you know what? Why don't we make it harder to qualify for Medicaid so less people get it so they save more money? We'll change the welfare code and we'll have higher premiums so that more people have to pay more money, so we'll raise money that way. Does that save the state money?
No.
No.
Why not?
Because when you get desperately sick and you wind up in the hospital, like that nurse said, for months at a time, there's the money. It's going to be triple.
Right.
Hi, Mayor. I'm Janine Miller with Project Home. I'm the Director of Advocacy and Public Policy.
And I'm Heather Bargeron. I'm the Community Education and Engagement Specialist at Project Home.
Nice to meet you both.
Nice to meet you. I feel like in many ways I've grown up here at Project Home. And for me, I can always gauge what's going on in our organization by the amount of people that are sitting outside of our office in the hallway. We work just down the hall here, and there's so many people that come every day that are seeking services and trying to make sure that they have a place to live. So I'm grateful to be a part of that work to help people find a way home.
I think one of the things that was maybe not hard, but was important for me to be able to do and just takes time is building relationships. So much of what we're doing is organizing and working alongside our residents who have experienced homelessness and poverty, and it's really important to pay attention to people's experience and stories, and there's kind of no way to do that without taking the time to get to know people. So it took some time to do that.
Yes.
So did your organization ever have to turn away families?
So interesting, just about a month ago, we have a new building opening up on 2415 North Broad Street. And there are 88 units where people can live. And 24 hours before we started accepting applications, people started sleeping on the sidewalks outside of our building just down the street. And the lines wrapped around the entire block and down the street. And over 1,000 people applied for 88 spots. So we're very much and for us that just shows how big the need is for affordable housing, because only 88 people are going to live in that new building, but more than 1,000 people applied.
Just to be clear, that's not for lack of Project Home wanting to be able to provide more affordable housing. That's about the will of our community and the political will of our city and our state and even our country to provide more affordable housing.
How will the proposed budget cut affect the service you provide?
Well, I think you kind of had the opportunity to sit and hear from our residents firsthand what some of their concerns are. I think just understanding that things like funding for housing, for supportive services like mental health and recovery services, funding for food stamps and food assistance, Medicaid, all of these are like pillars to people's survival, really, that this is really about people's lives. And so what it means is, either somebody has to make the choice between paying for medication or food, or paying for housing or medication, or sometimes more than one of those things has to go, and that literally that is a threat to someone's survival.
So there are about 700 people that live at Project Home. We provide permanent housing for people, and every month people are really struggle to like make ends meet at the end of the month. So it might be that people are running out of money to buy food. With some of the proposed budget cuts involve higher copays for things like medicine. And so if then people are paying for their medicine, but then already are running out of money for food, it just is, people are always making trade-offs. And we're seeing that more and more, that the people who have the least are really being asked for the most. Opportunities available for people on our website, projecthome.org. There's always a take action button, and you can join us to have your voice heard, whether it's around housing, opportunities for employment, medical, education. It's really so critical that all of our voices are heard in this time, so we have what we need as a community.
I think the other thing is just to know in Philadelphia a resource for people who are looking for services, especially people who are still experiencing homelessness, is that we do have a citywide homeless outreach program that is, Project Home is the hub of that, but it's part of a city coordinated effort. And so for people to know that they can call the hotline on someone's behalf or offer that number to someone who is on the street, and that is 215-232-1984.
I will educate myself so I can educate those who need to further their education.
I'm going to help those who are homeless by volunteering more at homeless shelters.
I plan to go to rallies and spread as much awareness as I can to the people around me.
Life is 10% what happens to us and 90% how we react to it. Dennis P. Kimball.
I'm going to show this documentary to whoever I can to notify them about the effects that budget cuts have.
I plan to not look at all homeless people the same, because you never know the different situations and everything, so you can't assume.